Hello and welcome back to this edition of Bayou Time. I'm your host, Keith Whiteside, licensed clinical social worker. Thank you so much for joining me. Always glad to have people here in the studio who can tell us more about how to take care of ourselves. You know, that's one of the things we all need to get better at. We want to welcome into the program Dr. Kalisha Hanley, who is a dentist with Teche Action Clinic in Morgan City. Welcome to the program.
Thank you. I'm honored to be here.
We appreciate it very much. Now, look, being a dentist in this area has probably got quite a few of its challenges, but maybe you can tell us a little bit about why oral health is so very important and the correlation between that and our overall health.
Absolutely. I'll first start by saying that good oral health has a positive impact on your overall health.
Okay.
But just like that, poor oral health can have a negative impact on your overall health. See, the mouth is like the gateway of things getting into the body.
Okay.
And so when you eat food and when particles go in, that bacteria mixes with your bacteria from the food and it causes that whole thing called plaque. Mm-hmm. Everyone's familiar with plaque.
Sure.
And if you don't remove plaque in 1 to 3 days, it becomes hard and then it becomes tartar.
Okay, so those food particles become plaque, plaque becomes tartar.
Exactly.
I've heard both of those terms, but I don't know that anybody's explained it to me that way.
Yes.
So tartar is once it's hardened, and
Exactly.
that's a real challenge.
That's the real challenge.
Okay.
And when you have plaque and tartar, those are like the adversaries of the mouth. Okay, that's the enemy. They cause bad breath, they cause tooth decay, and they cause gum disease. So when you have gum disease, there's so many different levels to it. You have the mild level, which you probably have heard of gingivitis.
Yes.
But if you don't treat it, it gets worse and it becomes more serious, and then it's periodontitis.
Okay.
When you have that advanced gum disease, at this point, your gums are turning red, they're starting to recede or shrink, you're starting to have inflammation and bleeding.
Bleeding, right.
And that's when it gets really dangerous, because that bacteria now has a gateway to your bloodstream. Your bloodstream goes from your head to your toe. So now that bacteria has access throughout your entire body. Now what happens when that bacteria decides to settle into your heart? It's traveling through your body and it decides to settle into the linings of your heart. Then you're going to result in endocarditis. Mm-hmm. And it can become even more serious and become congestive heart failure.
Right.
Now, the average person who has fairly good origin and good health, they don't have to worry about that. But if you do have advanced gum disease and you do have rampant cavities throughout your mouth and you have poor oral hygiene, then you become instantly have a potentially higher risk for cardiovascular disease.
And we see that combination or that correlation between cardiovascular disease and your oral health, because very often for you to be able to get medical procedures sometimes, you have to be somewhat removed from going to the dentist.
Yes, exactly. Before you perform certain surgeries, you may have to have dental clearance, and it's because that bacteria, the same bacteria that can cause an infection in any other part of your body, can also be found in your mouth. So making sure that the dental infections are clear in your mouth is a thing that many surgeons want to make sure before they go invasive into the rest of your body.
And being able to address those things. So, go ahead.
Oh, well, I was about to say, since I mentioned how it can be on the negative side, I want to make sure I tell you guys on the positive way.
Let's talk about the positive
I was about to say, let's
aspects of
focus
oral
on
health.
the positive.
Absolutely.
If you do practice good oral health care, you're really practicing trying to keep your mouth in good shape. It can have a positive impact on your overall body. For instance, diabetics. Type 2 diabetics are more prone to have gum disease just because they have uncontrolled sugar levels.
Right.
But did you know by getting your dental cleanings, by getting that gum disease under control, removing that bacteria that's from the sugar, removing it out of those gums and out of the mouth, that can lower your glucose level and essentially lower your HbA1c level? It's amazing when you look at it like that. By practicing just good oral hygiene in the mouth can help you with your overall health.
You give just a great example. I will tell you, I'm excited about being able to talk with my mom, who just found out that her hemoglobin A1C just yesterday went down significantly. So she's really excited. Her doctor's excited. Her nurse is excited. But she's a diabetic that's on diabetic medication. And now I get to tell her about the importance of maintaining her good oral health. And I will tell you, beautiful older woman. She's in her 80s, won't go where because she doesn't even look like she's in her 80s. But her care has always been so good. But I can let her know that the importance of that oral care may help maintain her blood sugars and her diabetes.
Exactly. And that's just one of it. Like if pregnant women, for instance,
Okay.
it has been shown through research that if you have poor oral hygiene, poor oral care in your mouth, and you have severe gum disease, then it can increase your chances of having a preterm baby or low birth weight. So if you're pregnant, your dentist is going to really encourage you, especially if your oral hygiene isn't the best, to come and get cleanings more often. A lot
Okay.
of times when you're pregnant, you may be more susceptible to cavities just due to the hormones are different. It's an increase of acid in your mouth. Your dietary habits are probably different as well.
You get envies that you wouldn't normally get.
And so it's just really important during pregnancy or anything in life that's changing your hormones to
Right.
get checked out.
I got to ask, what made you want to become a dentist?
I would say my fascination with teeth.
Okay.
A lot of times when I meet people, I may not remember your eyes. I may not even remember what you had on, but I always remember your smile.
And people will actually always remember yours. You have very beautiful teeth, as you
Thank
probably
you.
know.
Thank you
And
so
very nice
much.
gums, which makes a difference.
That makes a difference.
I was listening. I was listening. Take care of your gum care. But one of the things that I think very often, I actually do a lot of presentations all over the country, and I talk about people and the things that they like and things that they don't like. And I think a lot of people have a fear of the dentist, and they really shouldn't. So let's talk a little bit about what people can expect when they actually go to the dentist.
You know what? I love how you put that because so often when my patients come, they always tell me that I didn't want to come see you. And so I tell them I don't take it personally because I know that it's kind of scary. Someone's going to be picking in your mouth. But first thing I reassure them is that, I'm glad that you're here and we're just going to work together to meet whatever your goals are for your mouth.
Yeah.
Finding out what their goals are. Some of them, they want a new smile. Sometimes they say that their self-esteem is low because they have bad breath and they wonder, what can I do to get rid of bad breath? So I think first by finding out what brought them in is a good way of making them feel more comfortable when I can reassure them that whatever it is that brought you here, whatever issues it is in your mouth, that I can help you solve those.
What an interesting thing, because quite frankly, what you've done is you've basically just described why we fill paperwork out when we're a new patient
Right,
at
right.
a dental clinic or any clinic,
Yes.
because you want to do, and it's actually a therapeutic rule of thumb for us therapists. You start where the client is. You start where the patient is.
Yes.
You want to start with what is your need?
Yes.
Why are you here? So it's not
Right.
about you, the dentist, saying, I'm going to take care of these teeth. It's you, the dentist, saying, tell me what you want.
Exactly. Because I think that even though I'm a health provider, I'm also here to serve. So I can't truly serve unless I know what do you need to be served with. And so when they first come, yes, we go through their medical history. I
Right.
go through their medications. We're going to make sure that I am in the best position, knowing what I need to know to give you the best proper care.
Right.
But I'm addressing their needs and what they want, very important.
And even if they've had a recent procedure,
Yes,
that's often something we
exactly.
talked about that last segment. It's important to know if they've had something here recently that may prevent them from getting some care by you that day.
Exactly. When we're going over the medications, and that's why I tell patients that it's not a judgment thing. We want to make sure that we know your medication so we can better serve you. If you're on blood thinners, if you're pregnant, I want to make sure that regardless of however, if I have to write a prescription or whatever procedure we would plan to do, that I'm never going to put you in harm's way. We take x-rays, and I tell them it's going to be an easy visit. We're going to talk. Taking pictures or x-rays will be a way that I get to know your mouth. And then I'm going to go and look in, and I'm going to be looking at your teeth, your gums. I'm going to do oral cancer screenings. I'm going to look all around and then try to get the best treatment plan so I can help you reach your goals.
And again, it's a great starting point, and it's easy. It's going to be an easy visit, this first one.
Very easy. A lot of times they come and they say, well, I just want my cleaning. And I tell them, well, let's look at your mouth so I can decide what's the best type of cleaning, because there are more than one type of cleaning.
Okay, let's talk about those different options for cleanings.
Okay, so you have two common ones. One's the regular cleaning, which we
Okay.
call prophylaxis.
Okay.
And you have the deep cleaning, which we call scaling and root planing.
Oh.
Now, apparently the word is out about it because I have some patients that come and they tell me, I want the deep cleaning because I want my teeth really clean.
Don't
And
you just give me that part time. I want the full time
right,
stuff.
yeah.
I want all of it.
And so I tell them, I was like, well, first I smile and I tell them I'm going to make sure we get your teeth clean as much as they need. And then I take that as an opportunity to educate them that regular cleanings are for people that have plaque, tartar, stains above the gum lines. If I can see it, I can get to it, just a regular cleaning. Deep cleaning is when the x-rays are showing me, or there's evidence in the mouth, that we have more bacteria and tartar underneath the gums, and that there are things underneath the gums that don't belong and needs to be cleaned away. So I tell them, if you don't have anything underneath the gums that need to be cleaned, no need for me to go deep. Okay, so once they hear what's the difference between a cleaning and a deep cleaning, then they're more like, okay, well, I hope I just need a regular cleaning.
Right. So,
Yes.
so you want the elevated service until you realize what the definition of it is.
Exactly.
And then you're like, I'll settle for less is more in this case.
Exactly. That's the part about patient education.
Yeah.
The biggest thing when someone comes to the dentist is to get educated, because you're going to be with me for probably less than an hour, maybe even just half an hour. But when you go home, knowing what to do when you go home, those oral health care instructions, that's what's going to be the main thing, is what you take back home with you.
Right, and so it's really important. It's one of those things that all of us know going to the dentist, those of us who go to the dentist regularly, we know we get given this care package when you leave the dentist. And so
That's
the last
right.
30 seconds here of this particular segment, that's one of those things, the care package and the education really makes a difference once they leave you.
Yes, yes. A couple of things that I had to say, because some people, we get the care package and get the toothbrush and a toothpaste, and a lot of times I know at Teche we give them instructions. I don't know if it's ever read, so I will just reiterate. To brush 2 times a day, in the morning and in the evening. Bristles come in soft, medium, and hard. Make sure when you look at those toothbrushes when you buy it that it's a soft bristle.
So we were talking about some of the things in that care package that people go home with, but we missed out on a couple of things that are awfully important. Let's let you pick up there.
Okay, so we talked about the toothbrush, the soft bristles, brushing twice a day. And make sure that you're changing those toothbrushes out after every 3 months. The bristles gets worn away and it's not going to be as effective.
Every 3 months, twice a day, change them out 3 months. Got it.
Yes. And then flossing. Flossing is so important because the toothbrush is not going to get all the areas of the teeth. When you chew food, particles get stuck between the teeth. But many of my patients admit to me they only floss when they feel food or meat stuck between their teeth.
Right.
Whether you feel it or not, it is there. That bacteria is there, and you have to remove it with floss.
Got to floss.
Yes.
And then after you floss, there's something else that's really
That's
important.
right. You have to rinse.
There you go.
Mouthwash. Mouthwash is important. It comes in so many kinds. You have the anti-cavity mouthwash, the kind that fights gum disease. You have whitening. You have the type for sensitive teeth. Any type of mouthwash you use should be effective for your mouth. So if you know you're prone to cavities, if you know that your dentist has been talking to you about gum disease, use a mouthwash that's going to help you with your oral health.
It's almost like the beginning point that you start with your new patients is let's start with where you are and what you want.
Exactly.
And so getting mouthwash is the kind that you need.
Yes, yes.
And so now for those people that are watching, those people that in the public that are saying, well, for whatever reason, I've lost my teeth. Why should I go to the dentist? It's a question you probably get pretty often.
I do get that often. Many
Okay.
times my patients are telling me, should I bring my parents? They don't even have teeth anymore. And the answer is yes.
Okay.
For starters, everyone needs to have an oral cancer screening. Oral cancer does not discriminate based on if you have teeth or how many teeth you have. Having everyone to get the oral cancer screening will allow us to be more proactive in our health because as we know, the key to cancer is early detection.
Early detection, yes, ma'am.
Now, aside from oral cancer, I want to encourage people to have teeth for the obvious reason. So you can chew. So you can chew and eat your food better. Mastication, or to chewing, is very important to your digestive system.
Okay.
Now, I have patients. I love my patients because they put me on so much stuff. They tell me that we have no problem eating. We can just gum it and swallow it. But I let them know, even though you're getting the gratification from tasting the food, your stomach and intestines have to work harder. The chemical digestion has to work that much harder to break down that food. That right there can lead to bloating, constipation, and a lot of food reactions. Aside from masticating, you need teeth so you can be able to speak. For instance, without having teeth, your tongue and lips can't make the proper contact with your teeth to support those syllables. Try saying the word fish without allowing your lower lip to touch your teeth.
Okay.
Or even the
Okay.
word thirsty, but try not allowing your tongue to touch your teeth.
Okay.
People who don't have teeth tend to whistle, spit, or talk with a lisp.
Okay.
Now, aside from the eating and the speaking, you also want teeth because of your facial structure. Not having teeth will allow for your lips and cheeks to start drooping in. Your jawbone won't be stimulated, so the bone will reabsorb. Overall, your face will droop, and then with the droopy face, it tends for people to look older. It gives an older appearance.
And nobody wants to look older than they are. I
That's
don't
what I
care
hear.
who you are.
That's what I hear. No one wants to look older. So
Right.
I tell them, so even for the aesthetic reasons and just to have that fuller facial profile, get the teeth. You can get dentures, you can get implants, but just doing that will allow you to speak better, allow you to chew better, allow you to have that fuller face.
And so it can make a difference. And you just kind of mentioned one of the things I was thinking, what do you do? What do you do for people that don't have teeth? But there are lots of options.
Oh, yes, lots of options. We have, depending on how many teeth you're missing,
Okay.
will determine if you want bridge, if you want to have a denture, or if you want to do implants. Several different options on that. But I have to say this, because I know there's some people watching that will say that, well, I already have dentures, so why should I still come to the dentist?
Here's why.
Over time, I'm sure they will agree, your mouth changes and the dentures start feeling loose. You're not able to have that snug fit like you once did. Coming to the dentist, we're allowed to do a reline, reshape the inside to make it fit snug and make sure they're still being able to chew correctly with them.
And it's a really big deal because we see it as people age or they change or they lose weight even. Their dentures start to rattle in their mouth. I mean, you can
Yes.
see that, or they start to fall out some. And it's just one of those things that's one of the things they can do. I mean, people have probably spent quite a bit of money on those dentures. Let's make sure that they're still working. Go back to your dentist
Exactly,
and take care of
exactly.
those. So we've got about a minute left as we wrap up these last few segments. Is there something you'd like to close with overall to tell your patients and potential patients who are watching?
I would like to close by letting them know that it doesn't matter how long it's been. Some people are embarrassed because they say it's been 20 years or they've never been to a dentist in their entire life. It doesn't matter how long it's been. When you come to the dentist, and once we get that treatment plan, and once we get you squared away, it's all good. We're starting on step one. Everyone has a fresh new beginning once you come to dentist. The first step is just agreeing to come, and then we'll be in partnership to make your oral health become optimal as possible.
And so it doesn't really matter when that starting point is.
Doesn't
It's a new
matter.
starting point for everybody.
Exactly,
And so
exactly.
it's a new adventure between you and your next patient,
Yes.
however, whenever they choose to do that.
Yes, well said.
Yes. Well, this has been some really good information. It's enlightened me in a lot of ways, and so I can't wait to speak with Mom a little bit about her oral health and how that's really impacted. And I'm really excited that Morgan City has the option for people to go and see you.
Yes.
So
very
thank
much
you
so.
for being a part of Teche Action, and thank you for being a part of our medical community taking care of people and their health.
Thank you. Thank you for having me.
Yes, ma'am. All right, and again, that is Dr. Kalisha Hanley, dentist over at Teche Action Clinic in Morgan City. Give her a call. She would love to see you. That's going to do it for this edition of Bayou Time. Don't go anywhere. A lot more local programming when we continue.